Due to the graphic nature of this program, viewer discretion is advised.
Get him on IV fluid.
Milwaukee Emergency Center for Animals Television is brought to you by Animal Fairy Charities, a premier organization focusing on animal welfare while teaching compassion to young children through education, experience, and leadership. For Pet's Sake Dog Training, Bichon and Little Buddies Rescue, and Camp Bow Wow, premier doggy day and overnight camps.
This is a 11-year-old male intact Doberman Pinscher that presented, I think it was about 3 o'clock in the morning. He came in and he was bloated. So his stomach was twisted, and it was twisted so badly that it actually twisted the spleen too, and the vessels were all thrombosed. So they had to take the spleen out, and then they had to rotate the stomach back to its normal position, and then suture it to the side of the body wall so the dog doesn't twist again. So bloated dog. So you can see that here's the stomach. This is all the abdomen. This is the stomach, and this is the sign, like a Popeye sign they call it, because normally this part of the stomach should be sitting down over here, and it is completely flipped over. So that's why, and then what happened was the spleen is right here, and the spleen flips with the stomach because it's partially connected to the stomach. So it flips too, and when it flips for a long period of time, sometimes it'll rip those vessels that are attached to the stomach, or because it's flipped and wrapped around so tightly, the splenic vessels become thrombosed, so there's little clots in them. So he's just recovering from surgery right now. He's got a super long incision line right here from his edge of his penis all the way up here, and he's just recovering right now. And they just got out of surgery about 6 o'clock this morning, so he's still sleeping and recovering from surgery. We're doing a continuous ECG on him, so he's got pads on all his paws so that we can read the EKG continuously here to make sure, because real common after this surgery, after they rotate the stomach back to normal position and take a spleen out, you can throw beats, abnormal beats that are called VPCs, or ventricular premature complexes. So that's pretty common after this surgery. We're just continuously watching the EKG to make sure this doesn't happen, because if he starts throwing VPCs, then we have to put him on an anti-VPC drug, which is called lidocaine, and that's pretty extensive treatment. So we're hoping he's not one of those that throws VPCs. They can start the abnormal rhythm anytime between before surgery, during surgery, or 48 hours post-surgery. So we'll be monitoring him for the next at least 48 hours on the continuous ECG. He'll get up probably this afternoon. We're going to try to get him up because just like in people, after they have surgery, we want him to get up at about 6 to 8 hours post-surgery so that you get him moving and you try to prevent them from throwing clots, which is very important, as you see in people too. After surgery, they make you get up even though you don't want to. He's a big dog, and we want his circulation moving. So we'll get him up in a few hours and start to walk him outside. We want to get him up at least standing.
Hey, come on. Come on. There you go.
When did you come in here? Was it 3 o'clock in the morning? Or?
Oh, about 3 o'clock in the morning, yes.
And did you know right away?
Yes.
Okay.
I have known about bloat in large dogs for a while now, and every time they eat, and I tell my husband, don't let them run around, don't let them play, so they rest.
Yes.
This wasn't the case. He ate immediately. He wasn't himself.
But what happened in the middle of the night after eating, like she said, he must have twisted immediately, formed gas from eating the food. Stomach twists on itself and they become very uncomfortable. And she got him in the car and got over here right away. They recognized what happened, and you saw Dr. Foster.
Right.
And Dr. Foster had him in surgery, I think, probably within an hour or two.
Yeah, it was a very short period of time.
Yeah, and very, very scary situation, right?
Right,
And
because I know if you don't do surgery for it, then they'll have to get put down.
right. And obviously, this is only 24 hours,
Right.
little over 24 hours after surgery, and look at him already, right? You're good, aren't you?
I think the treatment was great. Dr. Foster was very friendly, very informative, very calm. She explained things to me. We kind of knew what to expect because we kind of figured what was wrong with him was that he had the bloat, the twisted stomach. But everybody up here, it was very nice.
Milwaukee Emergency Center for Animals Television is brought to you by Animal Fairy Charities, a premier organization focusing on animal welfare while teaching compassion to young children. For Pet's Sake Dog Training, Bichon and Little Buddies Rescue, and Camp Bow Wow, premier doggy day and overnight camps. And now, a word from our sponsors.
For over a decade, Fetch magazine has examined the unique bond humans have with their canine companions by publishing popular dog-related topics. With a strong commitment to dogs in need, Fetch also prints local adoptables in each issue, supplies affordable advertising to businesses, and gives rescues 30% off of ads. This year, Fetch is offering $15 subscriptions for your convenience. For more information, visit www.fetchmag.com or pick up your free copy at a local pet establishment near you. Go Fetch!
Boarding, grooming, training, and more. When it comes to your pet, Animal Motel is their home away from home. At Animal Motel, we offer a top-of-the-line facility with boarding suites for both dogs and cats, outdoor play yards, a training hall, and so much more. Whether they're here for obedience training, grooming, or an extended stay, we promise your dog and cat will be part of our family. Animal Motel, Personalized care for your precious pets.
Looking to get some training for your dog? For Pet's Sake is your one-stop dog training center. We offer all-inclusive obedience training, canine sports training, specialty classes, and more. We provide training classes in 3 convenient locations with our main facility in Mugwanago, which boasts a fully matted 5,200 square foot training hall. While in Mugwanago, check out our Bichon Buddy Rescue and take home your new pet. Bichon and Little Buddies Rescue takes in Bichons, other small dog breeds, and cats that need to be rehomed for various reasons.
So this is Benny. Benny's 4-year-old male neutered bunny. They're putting him under mask anesthesia first, getting him down. We gave him a pre-op pain medication and anti-anxiety medication. So he's pretty sedata ready, and then we're going to just give him a little mask anesthesia and then keep him under isoflurane gas anesthesia during the procedure. 3 different bunnies came in here for the same problems: grinding their teeth, not wanting to eat hay, which is pretty common when they have teeth problems. So all 3 of them, we're going to look at their teeth and see if they need points cut on the teeth. This is the dental apparatus made for guinea pigs and rabbits. So you can put their mouth in here and then widen this and open up their mouth and look inside. Rabbits and guinea pigs have a ridiculously small mouth opening. It's not like a person or a dog or cat where you open up the mouth and you can see everywhere inside. Rabbits and guinea pigs, even when you put them in here and widen their mouth, it's so difficult to see the teeth. And because they continuously grow, generally speaking, once they have points on their teeth, they're probably going to have to come back in every 3 to 6 months. And this is the gas anesthesia that's going into the small little mask and keeping him under anesthesia. Well, it's not a very painful procedure because it's just points. So it's just like having little points on your teeth that you have to grind down. And the points are there is because she's not feeding a good diet that causes the rabbit to grind the teeth every day. So if you feed primarily hay, then what happens is they spend the whole day grinding their teeth, eating the hay, and they eat lots of hay all day long, just like cows do. And then they grind their teeth all day long and keep the points from forming. So if she changes her diet, theoretically, we're hoping that she's going to be able to prevent them from getting so many points on their teeth.
So what I'm going to do is I'm just going to burr down the teeth again, like Dr. Lichtenberger said, to ensure that he's got appropriate occlusion of his teeth so that he doesn't have things like, lingual ulcers or ulcers on the tongue, and so that he's appropriately chewing down his feed. Want to protect the tongue from the burr because it is high speed, so we don't want to injure the tongue further. So a lot of the times you can use broken tongue depressors to push the tongue aside and protect it. And then because the burr is such high speed, it's really important to make sure that we're moistening the teeth so that we don't damage the tooth from heat. So I have completed my portion of the dental. So I've worn down the teeth so that they look more natural in terms of their formation. I've gotten rid of most of the big points, taking care to avoid the gum. Again, this ulcer will bleed because this is part of his dental disease, so we'll place him on antibiotics to make sure that he doesn't get any secondary bacterial infections. And then, we'll recommend appropriate husbandry, good diet, good things to munch on, and again, we'll see how he does in 3 months. It's also really important to make sure that bunnies keep their nails nice and short, just like us. So routine nail trims at home. Routine nail trims at home is good, right? It's kind of waking up, kind of feeling that. Okay, bud. You want to measure down where the quick or the pink portion of the nail ends, and then cut just above that so you can see that, I haven't made him bleed, but he is sensitive to it. So routine nail trims will avoid and decrease the sensitivity that he feels for nail trims.
Scratching his ear too.
Yeah, I saw that poor little thing. And then don't forget the dew cloth, because they'll hide that, and then that can grow and curl as well. Oh, but I know.
Got a face only his mother can love, right? Candy is about a 5-year-old male, now neutered dog that came in about 3 days ago for not being able to urinate. And he was straining at home and had been straining for about 48 hours. And this is the bladder. The abdomen is right here. The urinary bladder is right here, and you can see all these little white stones in the bladder. And then once we saw that, with the dog straining and couldn't urinate, we took a shot of the urethra. So the bladder is right here, the back legs, and then the urethra comes down like this, and you can see all these tons and tons of stones all lined in the urethra that was blocking the bladder, and that's why the dog couldn't urinate. So they actually, when they did the surgery, they had to cut into the urethra, get all these stones out, then they had to turn the dog around and go into the bladder and then get the stones out of the bladder. Right now he has a urinary catheter in his bladder going up his urethra, and it's sutured into place, and he's had that in for about 3 days. We want the urethra to heal because they had to open up the urethra in multiple places just to get the stones out. They were so badly stuck. And so he's urinating through that into a urine bag. And then what they do is they count the amount of urine to make sure that what we're giving him in fluids, he's producing into the bag. And then we'll remove the urinary catheter probably tomorrow and make sure he's able to urinate. And the reason we kept it in so long is because they cut right into the urethra, we want to make sure that that heals properly and it doesn't constrict, because if it constricts down, then he's going to have a problem, and they'd have to cut off the penis or some other procedure so that he could urinate. So the best possible thing is we're going to have him so that that heals up, the urethra heals up, and he's able to urinate on his own. And then they neutered him too at the same time. So the owner said, go ahead and neuter him as long as you're in there surgically, and that's better for him because his prostate was a pretty big size too. And I think they took out about 27 stones out of him. So now he'll go on a special diet. Once we find out what kind of stones those are, he'll go on a special diet and try to help that he doesn't produce those stones anymore. Here he comes. There, over there. Wrong place. There we go. So I know you guys are super happy. The big thing about him is that we're still waiting on the cultures of the urine and to see which antibiotic is going to be the best antibiotic. So the instructions are on here. If you want to give the one antibiotic is once a day.
Okay.
And this is twice a day. Okay.
Okay.
And that's because he had such a drastic infection
Yeah.
when they went in and got the urine out and evaluated the urine sample, you know.
You're so happy.
And we had taken out the urinary catheter, and he's been able to urinate very well, which is good because we were so worried about with all those stones in the urethra that there was going to be, you know, a stricture of the urethra, but it appears like he's going to be fine. The other one is a pain medication, that's Rimadyl, and that's twice a day too. And this is the same type of medication. It's a pain medication, gabapentin, and that's about it. Do you have any other questions? He went through a huge battle here, you guys, and then we'll call you with that stone analysis too, to figure out what type of diet he's got to be on for the rest of his life.
Okay. I came home from work and just noticed there was multiple piles of throw up around the house, and Tandy just looked very unlike himself, so we knew something was wrong. And for the last week before that, we noticed that he wasn't going to the bathroom like he used to be able to. He had to go all the time, and he wasn't always he wasn't peeing most of the times when he went, so we knew something was definitely wrong. We're very happy that they were able to get him all fixed up so that he can be healthy and happy again at home.
Hi, I'm Jonathan Lucroy, professional baseball player. I'd like to thank Mecca and Dr. Lichtenberger for taking care of my dog Dash and helping him out with some immunization stuff. I'm honored to get such good medical care, and I'm proud to be part of the Mecca TV show.
So this is Mo. This is a 2-year-old male intact hedgehog that is, and especially when they come in here not rolled up, because normally when they're stressed they roll up into a little ball. That's their response to stress, because when they're out in the wild, their predators don't get a hold of them. When they wrap up in a ball, then only see how she's wrapping up as soon as I get near her. So normally they completely wrap up so that their back end of their body is curved inwards, and she's not even doing that. She's so sick. And normally they wrap up in a ball so only the quills are present, and then no other animal will get near to them, because who wants to eat a quill? You know, it's really sharp and prickly. All these quills are very sharp and prickly. And he came in for not eating and not using his back legs, so we're going to have to try to determine what's wrong with him. And normally when we want to investigate these guys because they all curl up like this and you can't even do an exam on them. We have to, just to be able to examine him, we have to put him under anesthesia, but I don't think he's going to be stable enough to do that right now. So we're going to try to take a temp. Yeah, normally they would never let you take a temperature. They would be all curled up already, so he must be very, very sick. The hedgehog is so cold that it's below 90 degrees Fahrenheit, and that's super, super cold. Their normal temperature is 100 to 102.5, so he's too cold even to wrap up in a ball, so this guy is very, very sick. So this is the hedgehog that came in stat because he's not rolling up into a ball and his temperature is so abnormal. We're not able to get his temperature up. And what we think he has, unfortunately, is wobbly hedgehog syndrome, which is a disease that hedgehogs get at about 2-3 years of age, and they get neurological signs where they can't stand. They're very wobbly. They're unable to move. This one is very, very aggressive, this particular disease. Sometimes they come in early stages where they're still able to stand and they're still able to walk, and most likely he's not going to get better. The only treatment for it is nobody knows the cause. We know it's genetic, but nobody knows exactly what the cause is. There's no way you can diagnose it except by post-mortem, and that's by getting part of the spinal cord or the brain. But this is very, very likely what he has. Unfortunately, she's going to euthanize. As you can see, this is not usual for a hedgehog. Normally this guy would be all balled up so that you can't even see its feet or tail or anything, and he's not even able to do that. So I'm going to take him in for her to say goodbye, and then she's going to euthanize.
Today's show was brought to you by Animal Fairy Charities, a premier organization focusing on animal welfare while teaching compassion to young children. For Pet's Sake Dog Training, Bichon and Little Buddies Rescue, and Camp Bow Wow, premier doggy day and overnight camps.